host, Hi, welcome to another episode of Live Healthy Miami Gardens Live. I am your host, Melissa P. Dunn, CEO of MD Marketing Network. I'm also a member of the Live Healthy Miami Gardens Communications Subcouncil. And I host these conversations once a month where we focus on COVID-19 and the flu. Today's guest is one of our medical provider for Live Healthy Miami Gardens, and she is actually no stranger to the show. So as I put my eyes on, I'm going to introduce you to Dr. Lawrence, who is, by the way, the Chief Medical Officer for Jessie Trice Health Systems. But to give you some background, Dr. Lawrence is actually very much homegrown. She grew up in Liberty City and went to Miami Northwestern Senior High School. After high school, she went all the way to Atlanta to go to school at Spelman before going to medical school at the University of Arizona School of Medicine. Now, her resume is quite intensive. She has done her residency in family medicine at the University of Miami Jackson Memorial Hospital. She actually also did another fellowship at the University of North Carolina at Chapel Hill. Now, this fellowship was in faculty development. So Dr. Lawrence is indeed an asset to our community. She loves focusing on community health. And prior to joining Jessie Trice, she actually worked for the University of Miami, where she was the medical director of the School of Health Initiative. So today we are joined by an expert, and our conversation is going to be around COVID testing. So we'll explore home testing. In fact, we're going to demo that, and we'll also explore what facilities in the city of Miami Gardens you can actually still go to for an in-person test. Dr. Lawrence, welcome to the conversation.
Hi, thank you for having me.
Man, I was so excited when I saw that there are very few people are native from Miami.
There's a few of us.
Like, I'm a transplant from all over the place, from New York and by way of Jamaica. So when I meet like a native South Floridian, I get really excited. So thank you for taking time out of your busy schedule to join me today. Before I dive into the topic, can you tell me a little bit about Jessie Trice?
Sure. Well, Jessie Trice, we've been in existence now for about 54 years. We have 14 practice sites, and we're kind of scattered throughout the county, having a presence in Liberty City, Miami Gardens, Overtown, and Hialeah. We offer a full scale of services from newborns through, we have our oldest patient who's about 104.
Mm-hmm.
And we offer, in addition to pediatric and adult care, we offer behavioral health services, dental, optometry, nutrition. We also have our own in-house pharmacy as well.
Oh, that's nice. That's nice. Yeah, we've done several things with Jessie Trice. I actually went to your location, Barbara Jordan location on 27th Avenue, right?
Yeah. Yes, and 206.
That is such a beautiful facility. Absolutely gorgeous. So congratulations on that.
And thank you.
Well, Dr. Lawrence, we're going to talk today about COVID-19. Before we dive into the whole testing aspect, how have you guys seen COVID impacting your health center? I've heard a lot that that the healthcare system has been stretched with this COVID pandemic. Has that been your experience?
Yes, we are seeing that the rates are increasing. We're back into that red zone, meaning that we should be in our mask. Our rates right now are at about 23%. That's almost one.
Oh, wow.
Yes. So definitely it's got a presence here within the community.
Yeah, and I actually spoke with somebody 2 days ago that had the flu and COVID back to back. She's like, it was the worst experience ever.
Yes, and because of that, I highly recommend having the vaccine. Having it back to back is one thing. I want to point out that it's also possible to have both at the same time.
So can you get your flu shot and your COVID shot at the same time? Or is
Yes,
it
you
you have to
may.
space them out? You can.
No, there are no
Okay.
contraindications to getting them together.
Okay. And then folks can still go to Jessie Trice to get both. Yeah.
Yes, yes, you may.
Okay. Do they need an appointment or can they walk in?
So we do a combination. I strongly encourage appointments to avoid a wait time. We do take some same day appointments as well. We will try to accommodate.
Okay. Well, and
And
we're putting, go ahead. I'm sorry. I didn't mean to interrupt. I thought you paused.
oh, no, it's okay. I did want to point out that we do offer the testing and the vaccinations Monday through Friday, but at certain times. We typically do the testing in the mornings from 9 to 12. And we do that at Barbara Jordan and also at the Fatima Safar site in Liberty City. And we also do the vaccine testing in the after. I mean, we do the vaccine administrations in the afternoons, Monday through Friday, from 2 to 4.
And those are the Liberty City site and then the Barbara Jordan site.
Yes.
Okay. All right. That's good to know. So if you want to get tested, you go in the morning. For vaccination, you go in the afternoon. And we have the phone number running at the bottom of the screen right now. I think this address that's here is perhaps the address for your main center. But if you call that 305-637-6400 number, that's where they'll make the connection for the appointment. Yeah?
Yes, that is correct. We also have a for patients who are established Jessie Trice patients, they may go onto their patient portal to schedule an appointment. And we also have a chat bot on our website where you may request an appointment as well.
Oh, fantastic. And what's the website address?
jtchs.org.
jtchs.org. That's pretty simple to understand. So, Dr. Lawrence, why is it important for folks to still get tested for COVID-19?
Well, it's important for a couple of reasons. One, if you have COVID, you definitely want to know for your own protection. You may want to seek treatment. The earlier that you get treatment, the better the outcome. But also you have loved ones that you want to protect. So you may want to consider testing before you know you're about to go out to a gathering.
Yeah, that's true. And then for somebody like me that's always around people, it makes sense to get tested often. Now, I heard that some locations are no longer offering free tests. Is that the case for you guys at Jessie Trice? You have to pay for it?
No, your testing is done free of charge, as well as the vaccine.
Okay. So in the city of Miami Gardens, community health center providers like you perhaps will offer the testing either at no cost, like Jessie Trice, or perhaps low cost. And
Yes.
then for us, I mean, I remember my very first COVID test. Oh my gosh. Is it the first one is when you had to lean your head back and they went down your throat, or is it your nostrils?
Right. So they offered a couple of different kinds. I think the most uncomfortable one was the nasal pharyngeal. That's where the swab had to go pretty far up into the nasal pharynx.
Oh, thank
And
God.
a lot of them.
I'm sorry, Dr. Lawrence. I'm getting used to your cadence of speaking. I didn't mean to interrupt you. Please continue.
No problem at all. A lot of the home tests, though, are a lot more easier to use in the sense that they're nasal. They don't have to go as far up.
Okay. All right. Well, I actually have a home test that I want to have you kind of walk me through.
Okay.
And this test is a Binex Now COVID test. Now, I remember getting this when the home test kits first became available. And
Yes.
in fact, I may have gotten this through Live Healthy. Either through Live Healthy or through My City. I don't remember. But what are some of the things that we should look for with this home kit, Dr. Lawrence?
So first, before doing any testing, you definitely want to wash your hands before and after.
Okay.
Secondly, you want to make sure that it's a test kit that is not expired. So you can check the back of the box to make sure that that expiration date is still within reach.
All right. Well, let me do that right now, because so if you use an expired test, then obviously the results won't be reliable.
Right. You cannot rely on those results.
Okay. Well, let me look at mine. Mine says, oh, how funny. Well, it's still expired. Mine says 22/11/21, but I could have sworn I saw another date on there. 22/11/21. So that means that this is expired, right? Because it's
So
now we're in 20.
On some of the kits, you may see two dates. One is the manufacturing date, and then the second one would be the expiration date.
Okay, so I do see two dates. I see 2021-12-27 as like the bolder date. And then the second date that I see is 2022/11/21. So I'm assuming then that the first date is perhaps the manufacturing date, and the second date for 2022 is perhaps the expiration date.
That's correct. That's correct.
So we are going to just use this for demonstration purposes only.
Yeah.
My test. Listen, I'm so happy that we're doing this together, because I perhaps would have been like, oh, I have a COVID test. Let me go and take it to see if I'm positive or not. And without even knowing to check that first. So I'm really grateful. And then my box is sealed. So
Okay.
and I didn't wash my hands first. So it's a good thing we're not doing this for real, because I missed that step too, Dr. Lawrence.
All
right.
So within your box, you should have a swab.
Okay.
You should have a dropper bottle.
Okay, so this is a swab. Oops.
Mm-hmm.
What is this? Is this what I'm going to seal it in after?
Yes.
Like it. And then I have this little tray thing.
Okay. So the tray can be used to hold your solution. Do you have a little bottle with solution?
No, I have this, and oh, so maybe I really had one of the first tests, because this has an envelope. Let's see what's inside the envelope.
And that's your card. Yes.
Okay.
Yes.
Okay, so this is a card. And then, oops. And then I have this, which is like, it's not anything. It's like peanuts. Okay, so I have the card.
All right. You want to be careful not to touch the card. Only handle the card around the outside. Do not touch the middle part where you see the little squares.
Okay. So I'm handling it with caution. Thank God for you, Dr. Lawrence, because I'm messing it all up.
The top of your card has the pink, that where the pink part, that is the top, considered the top of the card.
Where the pink is. Can you guys see that? Okay, the pink. So this part right here is the top. And then I'm supposed to hold it on the side like this.
Yes.
Okay, got it. So I have that. I have this thing. Am I supposed to open this too, Dr. Lawrence?
Not yet.
I don't know what this is. Okay, not yet. So we're putting that down. And then I have this little thing here.
That's your swab.
That's my swab. Okay, what do I do next?
All right. So you're going to lay the card flat on the table.
Okay.
With the pink side should now be down.
Okay. Yes, ma'am.
All right. Now remove the dropper.
The dropper. Is this the dropper?
Yes. I'm having a
Okay.
hard time seeing that, but there should be solution within it.
Well, you know what? This may be, it says on the back, it says the testing card, the nasal swab, and the reagent bottle.
Right,
So
the
this
reagent
must be it.
bottle. Yes.
Okay, so that's this. Okay,
So now
yes,
you
ma'am.
will open that.
Open this. Okay.
And with the card laying flat with the pink side down, you're going to
Uh-huh.
place 6 drops in the top hole.
Okay, so can you see it? So then this is the hole right here. Okay, I see it. Place
Okay.
6 drops in the top hole.
Yes.
Okay. One, 2, 3, 4, 5, 6. Okay,
Okay. All right. Now lay that down. Now
lay it
you're going
down.
to open your swab.
Okay, so I'm putting this back on the tray. Man, I feel like I should have perhaps had like a two phone operation going on here. So, so that they could. Okay, so I'm taking out my swab. Yes.
Okay. Now the swab, you're going to swab both nostrils. So you only need to put it in about 3/4 to an inch of the way. You don't need to go in further than that.
Okay. So swab both.
Okay. Right, you're going to place
Okay.
it in one nostril.
Okay. Got it.
Okay. You're going to circle it 3 times
Okay.
and then place into the other nostril and
All right.
circle
I
3
did
times.
that. Okay.
All right. Now, I wanted to point out that you should leave it in the nostril for about 15 seconds.
Oh,
So
snap.
it's not a quick 1, 2, 3 and you're out. Yeah, do it for at least 15 seconds.
Okay. I should have had a timer. That feels like 15 seconds.
Okay. All right.
Testing
now
it out.
you're going
Go into the other swab. Okay.
Okay.
All right. Yep. This feels like 15 seconds, Dr. Lawrence.
All right.
Okay.
That's good. Now you want to take that swab. You're going to put it into the bottom hole.
Into the bottom hole.
Right.
So just so you guys can see it, I'm putting in the bottom hole.
And then
like
firmly push it up to the top hole.
Oh, okay.
And leave it.
All right. So it's
Once
in there like this.
Yep. Right. Once you have it
Okay.
in place, you're going to turn it 3 times.
Okay.
All right. Now over on the side of the card, you'll see a little adhesive strip. You can peel that off.
Okay. Peel off the adhesive strip. So that's the strip right there, you guys. You can see it. And I'm going to peel that off. Yep.
All right. You're going to now close it up.
Closing.
And you'll need to wait for about 15 minutes.
All right. So we already know that this is expired. So, but we're going to continue the conversation while we wait for this result from this expired test kit. But that was pretty interesting though, because like that's nuanced, right? Like well, first of all, I mean, I would hope that I would have remembered to wash my hands first, right? But this whole idea of checking for an expired test, I would necessarily have done that.
Yeah,
and
you have to remember.
Yeah, and then the thing about it that's so confusing, and I don't know if it's because maybe I have one of the earlier test kits, but I can't distinguish. Like it doesn't, you know how when you go and you buy bread, it says best used by or expired by. It doesn't say that on this particular box. So it was a little bit of a challenge for me to distinguish between which date was which. So
Yeah, it
hopefully
gets
the
to be,
newer
it can,
testing kits is easier to figure out. And then the way how you walked me through the instructions a while ago in this, well, maybe I missed it. Was there instructions that I just didn't see or pay
there
attention to?
should be instructions in the box, either on the back of the box, or there's also should be a set of instructions inside as well.
I will. I don't know. So I don't see instructions on mine. Maybe I dropped it, but
What about the back? The back of the box?
on the back of the box, it does say the contents, and maybe I dropped it. I don't necessarily see instructions. I don't think mine came with
They should
instructions,
come with
Dr.
a set of
Lawrence.
instructions.
Okay, well, I am certain that people in Facebook and YouTube world that you will have a box with instructions that's not expired.
Yes, and if right, you can also download the instructions from the website too, the By Next website.
Oh, okay. Got it. That is like so weird. And they gave me this nice little tray too. But anyways, so how often should people get tested, Dr. Lawrence? Is there like a recommended protocol?
Sure. So definitely if you have symptoms that could suggest you have COVID, you want to test immediately so that you can start treatment if you need to, or if you need to go into isolation. If you have been exposed to someone known to have COVID, you definitely want to test probably 5 days after that exposure. If it's negative, consider repeat testing within 1 to 2 days.
Oh, wow. 5 days after, because it takes that long for the virus to show up. Is that the reason?
Exactly.
Oh, wow. That's a really good point. So I have a friend who, well, no, let me just ask you this. Is it possible to have COVID and not have any symptoms?
It's possible. You'll find that a lot of vaccinated persons, their symptoms are very mild. So yes, that is possible.
And then I would imagine that now with the cold spell that we've had in South Florida and across the country, that it might be important to have a distinction between the flu symptoms and the COVID symptoms.
Well,
Is there a
unfortunately,
distinction?
the symptoms are very much alike. One thing that might set the two apart is the loss of smell. But as you know, with just the common cold, a lot of times people will lose taste and lose smell anyway. So it's really hard to distinguish. And then
Okay.
sometimes with the flu,
It looks like we might have lost Dr.
and I'm sorry.
Oh, there you are. Yeah, you were saying?
Yeah, I was just saying that you can't always distinguish the symptoms from each other. They're very similar.
Okay. They're very, very similar. So I think the takeaway here is just to be vigilant, right? To keep practicing washing your hands and wearing a mask if you're going to be in a crowd, and practicing social distance.
Yes.
And for goodness grief, if you have not yet been vaccinated or had your flu shot, consider doing that as soon as possible.
Yes, and just to remember that right now, Miami-Dade County is in the red zone, so masks are definitely recommended for indoor public places.
Wow, masks are recommended for indoor public places. That is, so then we are,
Right.
we are in the red. This is a new normal, y'all. We've got to still be vigilant. It's not back to the way it was, pre 2020. We are still needing to make sure that we practice common sense.
Yes, and the CDC and the health department, they update the zones that we're in each week. So every Monday they'll update, and we've been in the red zone now for I think about a month, 4 to 6 weeks.
Wow. Do you remember what Broward was? Not that.
Yeah, Broward actually was not too far behind. It took them a little bit longer. But
Oh, wow.
one thing that is good that we can boast is that our vaccination rates here in Dade County are higher than those in Broward.
Oh, yes. Come through, Live Healthy Miami Gardens and the rest of Miami-Dade County. I'm in Broward, so that was me asking for my own benefit, Dr. Lawrence, because I'm just curious. So, so again, can you tell us if somebody wants to get a free COVID test, how they can access
Mhm.
that service at Jessie Trice?
Sure. So you have a few ways that you can go about it. One is just calling the number 305-637-6400. Or if you're already a patient of Jessie Trice, you may go onto your patient portal and request an appointment. Or you may use the chat bot, which is on our website, and request an appointment that way.
All right, fantastic. And we are scrolling the contact information at the bottom of the screen. So you'll see the phone number that Dr. Lawrence mentioned, the 305-637-6400. And then, of course, jtchs.org. Do you think it's been 15 minutes? I wasn't even timing it.
Maybe. The question is, do
So
you see a line?
I do see a line. I see, let me hold it up. I don't know if you guys can see that. Maybe if I turn off the
One
light.
blue line.
I see one pink line. Let me turn off the light. Maybe you can see it better. Hold on.
Okay, so one line suggests that it is
There
negative.
you go. Can you see it?
Not really. I'm sorry.
So that's all right. So there's one line at the top there that I can see. And according to
Okay, one line.
Mm-hmm.
No, one line is negative. Two lines would be positive. Again, I want to stress
Woo-hoo!
the importance of waiting the 15 minutes.
The full 15 minutes. So the full 15 minutes will probably happen when we're done talking. But this is good news, except that it's not reliable news because my kit is expired.
Right. So if by chance afterwards you do see two lines, you definitely need to repeat the test, okay?
Okay. Definitely repeat the test. And let's just say that it is positive, Dr. Lawrence. What do I do then?
All right. So if you're not feeling well, and you know that you may have some comorbidities like the hypertension, the diabetes that may predispose you to a more severe illness, you definitely want to think about reaching out to your provider to get the COVID therapeutics. Jessie Trice, we offer those as well. The most common one is called Paxlovid. I do want to point out that these antivirals work best if you can start that treatment within that first 5 days of being diagnosed with COVID. There are other antivirals that are given by IV infusion, but those are given at the healthcare facilities. The Paxlovid, other oral antivirals can be given at home. So if you test positive, again, reach out to your provider, reach out to Jessie Trice. We will set a telehealth appointment for you after you've talked to the provider and they prescribe the medication for you. You will be given instructions on which facility to report to, where to park, whom to call once you're there, and that medication will be brought out to you.
Got it. Wow, that is it's really good news to hear. I mean, I think when COVID first came out, we didn't know what to do, what to expect. There was very little protocol in place, and it sounds now like there's a whole protocol in place for testing, vaccination, and if diagnosed, treatment.
Yes, definitely. So
Well,
there are a
that's
lot of
certain.
treatments available. I also want to point out that your provider may decide that you need some additional treatments as well. But those can be discussed at the time that you're positive.
Wow. Well, that is some really good news. We've come a long way with this horrible pandemic that we've been sharing, this pandemic nightmare that the whole world has been engaged in for the last 3 years. So we're definitely in a new normal. And it's still only one line, so that's good news.
That is
But
great news.
but I think I'm gonna request an unexpired at home test. Dr. Lawrence, thank you so much for sharing your time with us today. Any final words of wisdom?
No, just stay safe. Be aware of what zones we're in each week. Right now we're in the red, so the masks are definitely recommended.
Wonderful. Well, thank you so much for joining us. And thank you at home for watching. I want to remind you that livehealthymiamigardens.com is a very trusted source of healthcare information, showing resources that are available to you, Miami Gardens residents. So please go to livehealthymiamigardens.com and find out about your local resources. So thank you for joining us. And remember, be kind and loving to yourself today. You absolutely deserve it.